and welcome back to Living Well with Dr. Thanuki. Today the topic of discussion would be the metabolic syndrome. So what is metabolic syndrome? Metabolic syndrome is a constellation of disorders including obesity, insulin insensitivity, glucose intolerance, and high blood pressure, dyslipidemia and visceral adiposity. So the metabolic syndrome is of great importance to us because individuals who have metabolic syndrome are twice as likely to develop cardiovascular disease in the next decade, and the lifetime risk of developing cardiovascular disease is even higher. And individuals with metabolic syndrome are also having a risk as high as 7 times of developing type 2 diabetes. So there is a clear link between obesity, excess visceral adiposity or fat deposition in your trunk area, and the pathogenesis of metabolic syndrome. And certain individuals of certain ethnicities, especially us who belong to the Asian Indian category, have a very high likelihood of developing metabolic syndrome even at very low levels of visceral adiposity. Although the exact statistics in Sri Lanka are not known, in US 1/3 of the population is expected to be suffering from metabolic syndrome, and in Sri Lanka we expect a high prevalence of the disease as well. So an important fact to remember is that more than 95% of the individuals who have metabolic syndrome have a BMI of more than 25 or greater, which means that they are either overweight or obese. As mentioned in the obesity video, the type of fat deposition or the area in where your fat is predominantly deposited matters, and the android or the male pattern, which is metabolically active, where fat is deposited around the visceral organs of the abdomen, it's characteristic of metabolic syndrome. And but when it comes to individuals who have a BMI of 30 or more, who are extremely obese, regardless of the body shape, they are expected to have visceral adiposity and likely to have metabolic syndrome. So if you don't have a concave or a scaphoid abdomen when you lie down, we suspect that an individual has visceral adiposity and at risk for metabolic syndrome. The pathophysiological features of metabolic syndrome include insulin resistance at the skeletal muscles and the liver, atherogenic lipid profile with high LDL and triglycerides and low HDL. So low density lipoproteins, high triglycerides and low high density lipoproteins. Also elevated blood pressure, which is called hypertension, prothrombotic state with plasminogen activator 1 and also fibrinogen, and increased inflammatory state or pro-inflammatory state with high sensitivity CRP. The pathophysiologic features of metabolic syndrome include insulin resistance in the skeletal muscles and in the liver, dyslipidemic or atherogenic lipid profile with increased LDL and triglycerides and decreased HDL, hypertension or high blood pressure, and a pro-inflammatory state with increased high sensitivity CRP, and a prothrombotic stage with increased plasminogen activator inhibitor and fibrinogen. The prothrombotic and the pro-inflammatory states of metabolic syndrome occur mainly because of the visceral adiposity associated with it, and also this is what leads to a development of coronary vascular disease conditions. So in metabolic syndrome, the insulin resistance cause decrease uptake of glucose and decrease synthesis of glycogen, and also decrease suppression of the hepatic glucose production by insulin. Initially, individuals will have normal blood sugar levels or be normoglycemic, but with time, due to glucotoxicity and lipotoxicity, the pancreatic beta cells will be undergoing what's called apoptosis or death, and there will be very less insulin production, and which will not be enough to compensate for the rise in glucose and to maintain a normal glucose level or a euglycemic level. This will lead to people developing type 2 diabetes. So insulin resistance that develops type 2 diabetes also contribute to the development of cardiovascular disease in people with metabolic syndrome by triggering endothelial dysfunction and also decreasing nitric oxide, which is a potent vasodilator. To diagnose metabolic syndrome, you need to have 3 of the following criteria that I'm going to mention. Abdominal obesity, characterized by a waist circumference of more than 40 inches for men and 35 inches for women. Triglyceride level of more than 150. HDL level which is less than 50 for women or less than 40 for men. And a blood pressure that is higher than 130/85. And a fasting blood glucose which is more than 100. So the other biomarkers that aid in a strong diagnosis of metabolic syndrome include high sensitivity CRP level of more than 2 and urinary albumin creatine ratio of more than 30, and also high insulin levels, C-peptide levels of more than 4.6. The non-pharmacological treatment of metabolic syndrome include dietary and lifestyle modifications. So it is recommended to lose 7 to 10% of your body weight during 1 year, and to engage in physical activity 5 times a week, 30 to 60 minutes per session, and to consume an atherogenic diet which is less in saturated fats, less in trans fat, and contains mostly unsaturated fats. So the pharmacological treatment include treatment modalities which control the glucose intolerance, the high blood pressure, and the dyslipidemia, as well as obesity. So the surgical treatment for metabolic syndrome is bariatric surgery, and it has a very high success rate. It is recommended for individuals who have a BMI of more than 40 or a BMI of more than 35 with a comorbid condition like heart disease, diabetes, or obstructive sleep apnea. And the success rate is quite high. So the ways in which individuals with metabolic syndrome would benefit from exercise would be the reduction in the abdominal obesity, and also HDL levels would improve, it will increase, and triglyceride levels will decrease in individuals with this disease, and the insulin sensitivity would increase, and high glucose states will be decreased, and also individuals will more likely to have controlled blood pressure as well. So physical activities are quite important in the progression of metabolic syndrome because it has been found that individuals who engaged, especially in leisure time physical activity, we call this LTPA, were less likely to develop metabolic syndrome compared with their sedentary counterparts. Nutrition plays a key role, as mentioned in the obesity episode, in weight management and weight loss. And this is very important when it comes to decreasing the progression of metabolic syndrome and its symptoms. So therapeutic lifestyle diet is recommended for individuals who are planning to lose weight, who have metabolic syndrome. It emphasizes having less than 7% of fats from saturated fats, and more monounsaturated fats and low trans fats, and higher fiber content. The Mediterranean diet also has shown to have great results when it comes to weight management and improving the outcomes of patients who have metabolic syndrome, and it's primarily consisting of whole grains, fish, fruits and vegetables, and low in dairy and alcohol. To burn a pound of fat, you need to burn 3,500 calories, and in order to do that in a systematic manner, it is recommended to reduce the calorie intake by 500 to 1,000 calories, and this will help us in achieving a weight loss of about 1 pound or roughly half a kilo a week. So for the exercise recommendations, as per the cardiovascular training, it is recommended to have about 5 days of cardiovascular training, using large muscle groups, rhythmic movements, so jogging, swimming, cycling, rowing are good, and recommended to do about 30 to 60 minutes per session, or even in 10-minute bouts if you cannot do it continuously, that add up. If you want to lose more weight and keep the weight off, it's recommended to do more than 60 minutes or more for weight management. And as for the resistance training, target the primary muscle groups and do it a few times. So that was metabolic syndrome in a nutshell. Hope you guys found it useful. If you have any questions and you need our assistance, please don't hesitate to contact us or visit us. Please comment below for any information, like and share our pages, and subscribe to our channels if you haven't done so already, and please click on the bell icon for any notifications. I hope to be back next week with another topic. Thank you.